guidelines for safe fasting for people with certain chronic illness, such as diabetes, clinical practice recommendations for diabetic patients with cardiovascular disease are still unclear. And due to the scarcity of clinical trials or clinical practice guidelines, healthcare practitioners are unable to advise their diabetic patients with cardiovascular disease whether to fast during Ramadan or not. طيب الريسكس for diabetic patients who fast طبعا ال unhealthy dietary habits في رمضان increased carbohydrate diet, salt intake, less hydration and sleep disturbance with diminished physical activity might negatively affect the risk of cardiovascular disease in diabetic patients. And moreover, patients are less compliant with their medications, missing doses and avoid medical appointments which can be life-threatening. Also, abstinence from food for long period, along with anti-hyperglycemic medications and participation in physical activity may potentiate the risk of hypoglycemia. So, it is therefore extremely important that all people with diabetes who are willing to fast during Ramadan should be educated about the risk of fasting, such as dehydration or fluid overload, and the management of possible complications, including fasting termination if they become unwell. They should undergo clinical evaluation following Ramadan to re-evaluate the risk status and overall health condition. Risk stratification is the cornerstone for guiding diabetic patients whether to fast or not. And the comprehensive risk assessment-based recommendations for diabetic patients during Ramadan fasting are still controversial. And unfortunately, research data on the effects of fasting during Ramadan for people with cardiomyopathies, arrhythmia, or valvular heart disease are also limited. The ASD provides recommendations for risk stratifications in people with diabetes and cardiovascular disease who intend to fast Ramadan. هتكلم على أول entity من patients اللي هم diabetic patients with coronary artery disease. Diabetes can increase mortality and complications during Ramadan, an effect that persisted for 1 month after Ramadan. Also, they suffer from lowered platelet sensitivity to clopidogrel and non-compliance with antiplatelet therapy or dose change. Some studies recommended that patients within 6 weeks of acute coronary syndrome are advised not to fast, while others recommended that fasting in patients with recent PCI within 3 months recommended against fasting قبل 3 شهور من ال PCI due to the risk of stent thrombosis. However, the authors of the ASD consensus consider this is an underestimation of the situation. طيب, as regards chronic coronary syndrome, few studies have found no increase in morbidity or mortality in these patients during fasting Ramadan. However, these studies were small in sample size, observational, included patients mostly without diabetes, and lack of post-Ramadan follow-up limit Ramadan fasting recommendations. Also, there is a lack of a clear definition of close observation or specific information on patients' diet outside fasting. So, ASD recommends that people with diabetes and recent acute coronary syndrome within 6 months before fasting are considered a very high risk group and must not fast during Ramadan, as well as those patients with recent revascularization within the last 6 months before Ramadan. Regarding people with diabetes and chronic coronary syndrome, they are considered a high-risk group and shouldn't fast during Ramadan. Also, diabetic patients with stable atherosclerotic cardiovascular disease are considered a high-risk group and shouldn't fast during Ramadan. طيب بالنسبة للpatients diabetic associated مع arrhythmia أو who's taking anticoagulation, a study of 809 patients during Ramadan revealed that 50% of them modified their anticoagulation regimen without consulting their physician, leading to hospitalization for bleeding or stroke. Also, some studies reported that long QT syndrome in type 2 diabetes patients experienced an increase in GLP-1, gastrointestinal peptide, and insulin secretion, with a defect in a glucagon secretion, increasing the risk of hypoglycemia and cardiac arrhythmia. So ASD recommends that people with cardiac arrhythmia who are poorly controlled, considered a very high risk group, or even cardiac arrhythmia and treated by anticoagulation for stroke prevention in AF. Also, people with diabetes and long QT syndrome are a very high risk group and must not fast. As well as people with diabetes and prosthetic heart valve اللي هم already ماشيين على anticoagulation, they considered a very high risk group and must not fast during Ramadan. Regarding the patients with diabetes and heart failure, ASD recommends that people with diabetes and severe congestive heart failure or acute heart failure or ejection fraction below 35% are considered a very high risk group and must not fast during Ramadan. بالنسبة للpatients, diabetic patients and valvular heart disease, ASD recommend that diabetic patients with severe valvular heart disease are considered a very high risk group and must not fast during Ramadan, while those with mild to moderate valvular heart disease are considered moderate risk group and may fast Ramadan under medical supervision. Regarding hypertensive and diabetic patients, some investigators found that Ramadan fasting is associated with lower blood pressure in these patients with non-complicated essential hypertension or diabetes. And to our knowledge, no previous studies have investigated the impact of Ramadan fasting on hypertensive diabetic patients. So ASD recommends that people with diabetes and hypertensive urgency or emergency are considered a very high risk group and must not fast during Ramadan, while diabetic patients with uncontrolled hypertension are considered a moderate risk group and may fast under medical supervision. To avoid the risk of worsening of kidney functions, measuring of blood pressure, kidney functions, and revising hypertensive medications with diuretic components such as aldosterone antagonists or thiazide-like diuretics should be evaluated during a regular visit before Ramadan. Also, home blood pressure monitoring will help to track the patient's blood pressure response to antihypertensive therapy during Ramadan fasting. And for safe fasting, medications which are taken twice daily should be shifted to other alternative medications with the same mechanism of action but can be taken once daily. ده الجدول في تجميع diabetic patients بالcardiovascular disease. ال very high risk group هم ال patients اللي عندهم recent history of recent revascularization أو acute coronary syndrome في خلال 6 شهور. البيشنتس اللي عندهم diabetic patients اللي عندهم severe valvular heart disease أو مركبين prosthetic valve, diabetic patients with severe congestive heart failure أو acute heart failure أو عندهم ejection fraction أقل من 35%, hypertensive urgency أو emergency والpoorly controlled arrhythmia. الهاي ريسك جروب بتتضمن diabetic patients with chronic coronary syndrome and stable atherosclerotic cardiovascular disease, والmoderate risk group بتتضمن diabetic patients with mild or moderate valvular heart disease أو uncontrolled hypertension. شكرا لحضراتكم.